Which of the following best describes the primary benefit of antegrade cardioplegia over retrograde cardioplegia? A. Antegrade cardioplegia is better at distributing the solution to the entire myocardium. B. Antegrade cardioplegia causes fewer arrhythmias post-surgery. C. Antegrade cardioplegia is easier to administer and monitor. D. Antegrade cardioplegia is less invasive and does not require coronary sinus catheter. Answer: A. Antegrade cardioplegia is better at distributing the solution to the entire myocardium. Explanation: Antegrade cardioplegia delivers the cardioplegic solution directly into the aortic root, from where it is distributed through the coronary arteries to the myocardium. This method ensures more uniform delivery of the solution to the heart muscle, providing better myocardial protection. Which of the following substances is commonly included in cardioplegic solutions to prevent myocardial edema? A. Glucose. B. Mannitol. C. Sodium chloride. D. Calcium chloride. Answer: B. Mannitol. Explanation: Mannitol is included in cardioplegic solutions to help prevent myocardial edema by promoting osmosis and preventing excessive fluid accumulation in the myocardium during ischemia. This helps protect the heart from tissue damage caused by swelling during surgery. What is the effect of potassium-induced myocardial arrest during cardiac surgery? A. It increases myocardial oxygen consumption. B. It depolarizes the myocardial cells and prevents contraction. C. It promotes cellular repair and regeneration. D. It enhances coronary blood flow. Answer: B. It depolarizes the myocardial cells and prevents contraction. Explanation: Potassium-induced myocardial arrest occurs when high concentrations of potassium are used in the cardioplegic solution. The elevated potassium levels depolarize myocardial cells, causing them to remain in a non-contractile state during the surgery, allowing the heart to be protected from ischemia. What is the main disadvantage of using cold blood cardioplegia in terms of reperfusion injury? A. It may cause excessive myocardial rewarming upon reperfusion. B. It can lead to cellular swelling and edema after surgery. C. It may increase the risk of ventricular arrhythmias. D. It can cause oxidative stress and inflammation when blood flow is restored. Answer: D. It can cause oxidative stress and inflammation when blood flow is restored. Explanation: Cold blood cardioplegia, while effective at providing myocardial protection, can increase the risk of oxidative stress and inflammation during reperfusion. The sudden restoration of blood flow to an ischemic heart can lead to the formation of reactive oxygen species, ROS, contributing to reperfusion injury. Which of the following is a key principle of delayed cardioplegia? A. Administration of cardioplegia after a prolonged period of ischemia. B. Intermittent delivery of cardioplegic solution to the myocardium. C. Use of a continuous infusion of warm blood cardioplegia. D. Use of hyperkalemic solutions for rapid myocardial arrest. Answer: B. Intermittent delivery of cardioplegic solution to the myocardium. Explanation: Delayed cardioplegia involves intermittent delivery of the cardioplegic solution to the myocardium, allowing for more extended myocardial protection. It typically involves periodic infusion of the cardioplegic solution, followed by a brief period of reperfusion. What is the purpose of adding sodium bicarbonate to a cardioplegic solution? A. To prevent myocardial arrhythmias. B. To maintain the pH and buffer the solution. C. To induce myocardial depolarization. D. To enhance myocardial oxygen delivery. Answer: B. To maintain the pH and buffer the solution. Explanation: Sodium bicarbonate is used in cardioplegic solutions to maintain the pH and buffer the solution. During ischemia, the myocardium produces lactic acid, which can lead to acidosis. The addition of sodium bicarbonate helps to counteract this acidosis and maintain the pH of the cardioplegic solution. Which of the following is a common complication associated with retrograde cardioplegia? A. Coronary artery dissection. B. Increased myocardial oxygen consumption. C. Difficulty in achieving uniform myocardial protection. D. Increased risk of myocardial infarction. Answer: C. Difficulty in achieving uniform myocardial protection. Explanation: retrograde cardioplegia, while effective, may lead to difficulty in achieving uniform myocardial protection. Since the solution is delivered through the coronary sinus, it may not distribute evenly throughout the myocardium, particularly in the distal regions of the coronary circulation. Which of the following factors primarily determines the effectiveness of myocardial protection during cardioplegia? A. The temperature of the cardioplegic solution. B. The duration of myocardial ischemia. C. The type of surgical procedure performed. D. The patient's preoperative condition. Answer: B. The duration of myocardial ischemia. Explanation: the duration of myocardial ischemia is the most important factor affecting the effectiveness of myocardial protection. The longer the heart is deprived of oxygen, the higher the risk of damage. Cardioplegia aims to minimize ischemia by ensuring effective myocardial protection during surgery. Which of the following best describes the role of calcium in cardioplegia? A. Calcium helps prevent arrhythmias during the cooling phase. B. Calcium is excluded to prevent myocardial contraction during ischemia. C. Calcium enhances myocardial recovery after surgery. D. Calcium is used to induce myocardial arrest and prevent depolarization. Answer: B. Calcium is excluded to prevent myocardial contraction during ischemia. Explanation: calcium is excluded from cardioplegic solutions to prevent myocardial contraction during ischemia. The absence of calcium keeps the heart in a relaxed state during the period of arrest, reducing the risk of injury from excessive contraction or arrhythmias. What is the purpose of adding glucose to cardioplegic solutions? A. To provide energy to the myocardium during ischemia. B. To stabilize myocardial electrical activity. C. To enhance myocardial depolarization. D. To prevent myocardial arrhythmias during surgery. Answer: A. To provide energy to the myocardium during ischemia. Explanation: glucose is added to some cardioplegic solutions to provide an energy source for the myocardium during ischemia. Since the heart is deprived of oxygen during surgery, glucose can be used in anaerobic metabolism to provide energy and protect the myocardium from damage.